doing stuff from home, so she had used my computer on Zoom.
All right, we're live.
Okay. Hi, guys. Welcome to another virtual shadowing session with Predental Universe. My name is Tiffany, and I will be helping to facilitate today's session today along with Sherry. We have an exciting presentation today with Dr. Kiani. And on that note, feel free to take it away whenever you're ready, Doctor.
Hi, everybody. Good afternoon, Predental Universe. Thank you, Sherry, for contacting me and asking me to spend this evening speaking to you all. I am honored to be here with you, and I'm going to share a little bit about myself, my practice, my journey, and some of my personal experiences, and hopefully you guys will enjoy it. So my practice is Northern Virginia. I was just explaining to Sherry and Tiffany, and we'll talk about it at the end as well. If there's anybody that wants to come in for shadowing opportunities, to stop by and see the office, any questions you have, feel free to contact me. I have my email here, and at the end as well, you can kind of take it down. And let's get started. So the agenda for today is basically, I'm going to talk a little bit about my educational background. I will tell you guys why I chose dentistry, a little bit about preparing for dental school. Things have changed a little bit since I went to dental school. A little bit about my dental school experience, and then we'll talk about associateship versus ownership. We'll talk about kind of common things that I do daily in my practice, what things I like, what things I don't do. And then I'm going to share some case studies with you guys. There will be 3 cases actually that I chose for today's presentation. Hopefully you guys will enjoy them. And then please write down any questions you have. So I'll be happy to answer any questions you have. And then at the end will be a quiz. Tiffany and Sherry, I guess, are going to share the quiz with you guys. So this is just to make sure that everybody's paying attention and everybody's awake. I know everybody's probably tired from school and studying and all that stuff. So let's get started. So a little bit of educational background. Basically, I was born and raised in Iran. I moved to Virginia after finishing high school. I have a BS in biology from George Mason University in Northern Virginia. I went to Georgetown. I have a master's in biochem and molecular biology from Georgetown University. And I have my dental school degree from Nova Southeastern in sunny Florida, which I love. And I was just telling Sherry about it. I said, I highly recommend it. So hopefully she gets in if she likes to get in there. A little bit about my personal life. This is my family. I have 2 little girls. They are 8 and 9 years old. It's been a very interesting year this year, having them homeschooled on top of all the other things going on in my life. So they actually just started going back to school 2 days a week. So it's been very exciting actually to have them back at school. So I'm a wife, I'm a mom, I'm a dentist, and I'm a business owner. But a good life is a well-balanced life, and it's important to set your priorities right, and my family is definitely my number 1 priority. So the next section is basically about why I chose dentistry. So basically, I chose dentistry because of my own experiences from my childhood. I had a lot of time that I spent at my orthodontist office. I was missing a lateral incisor, and it was intriguing to me to see how my orthodontist was able to move everything and kind of bring my smile together. And that's kind of sparked the initial interest. So pretty early on, I decided that I wanted to be a dentist. While I was in college, I was part of Predental Society at George Mason University. Now, I remember back in undergrad, like this was over 20 years ago, so I'm a lot older than you guys. We had very limited resources. It's incredible to see how all of you share a common goal and you can connect via social media. You have this wonderful, website and Instagram page that everybody can kind of become part of, share information, have different doctors share their information. It's really nice. Back when I went to school, we really didn't have that. You really had to kind of go talk to your family dentist. You didn't have a lot of other people to talk to and connect with. I also worked as a dental assistant in multiple practices while I was in school, which was actually the best part of it was the best experience that I earned, honestly. It helped me with every aspect from going to dental school, being more familiar with the instruments, the things that we were using, compared to some of my classmates who had never seen anything in their lives. So to treating patients, and then once I graduated and became a dentist, it helped a lot, kind of knowing, because I knew the other side of the spectrum and kind of what goes on in the dental office. It really helped me become a better dentist, I believe. I graduated in 2007 from Nova Southeastern. Around that time, I actually met my husband, got married, and got settled in Boca Raton, Florida. Now, the plan was to graduate and come back to Virginia, because that's where I'm from. But I ended up actually settling there, taking the Florida board, and basically started practicing there. I was lucky enough that I found really good associate positions in Florida. So I was working in two different practices. There were group practices, which basically was a big office, super busy, lots of patients. We had endodontists, periodontists, oral surgeons. So early on, I learned that it's good to actually practice in that model, where specialists get to do things that are more specialty rather than one person being jack of all trades and trying to do everything. So that was a very good experience. I learned a lot there. I built up a lot of speed as well, because as you can imagine, working in these busy practices, you don't get to treat one patient at a time. You really need to, be on your toes. So they really kind of put you to work. What else? In 2011, I had my first daughter. In 2012, we decided actually to move to Virginia to be closer to my family. So once I moved here, of course, I contacted a lot of the dentists that I had assisted for prior to dental school. And that's why I was talking about how important it is for you guys to actually, if you're able to assist or shadow and build these relationships early on. Now I know you're very busy with studying and DATs and all these other things that you worry about. But if you can find some time to do either part-time work or some shadowing, I think it's really, really valuable, because these relationships you build, especially if you're going to practice, you're going to come back home, and practice there. So it's really nice to make these relationships. So I actually got a job with one of the dentists that I used to assist. So that was nice. I reached out to him. I said, I'm coming back. And he said, absolutely, come back and work for me. So I was an associate in his office in Leesburg, Virginia. And after about a year, I want to say, I actually had my second daughter in February of 2013, and that's the same year that I bought my own practice. Now, buying a practice is a very stressful thing, especially I know the amount of loans that the students are getting is even increasing now. But even for me, I had a lot of student loans, and the thought of going under a lot more loans just was very stressful to me. So that's part of the reason that I kept kind of working as an associate to try to pay off a little bit of debt and to be able to not be suffocated by all these loans. So I had a lot of my friends were either starting their own practice from scratch, just kind of, taking a risk and, building everything, taking out a big loan. And some of my other friends basically bought a very established practice with many patients and literally like the $1 million practice, and again went under more loans. So those both kind of sounded very scary to me. So I kind of had more of a humble start. I actually found a practice that was a smaller practice, and it was kind of with a very small patient base. The doctor was moving to North Carolina, selling the practice, and I was able to get a good deal. And so I bought my practice, and that was, kind of like 2 days a week. It really wasn't that busy, which was perfect for me because I had two small kids under the age of 2. So I really, it was a lot of challenge for me, as you can imagine, kind of starting something new. And, becoming a practice owner wasn't easy because I had zero business experience. That's another thing I recommend if any of you can take any undergrad business classes. It will definitely help you. Trust me. I had zero experience. I really didn't know anything. So I had to learn everything from scratch. And I guess part of buying a practice like that, you kind of learn everything yourself. I guess that's the advantage that came from it, because I got to do a little bit of everything. And sometimes I felt like I was like a one-man show or one-woman show, because I was literally answering phone. Then I would go in the back and treat my patients. I would do hygiene. I would do dentistry. I would sometimes do instruments, sterilization. So I've done it all. So when my staff sometimes gives me attitude, I'm like, listen, I have done it all, so you can't say. And even to this day, I will not ask my staff to do anything that I won't do myself. So it's very important to kind of know what goes into your office, from front desk, from scheduling, insurances. It's important for you to be also aware of these things. Um, so basically, I couldn't have done it without the support of my family. Obviously, my husband has been very supportive, and he's been there every step of the way. But it was definitely a very challenging time. The first 3 to 4 years of any kind of business, it's very challenging. The dentistry part is one thing, mastering dentistry and becoming good at your art and craft and everything, and being confident, that's one thing. And becoming good as a business person, that's a whole other thing. That's why I kind of recommend that if, once you are a dentist, it's important for you to kind of work a little bit as an associate before diving in and wanting to own your own business, because it's really important for you to just get better at what you do first, without worrying about the bills, without worrying about the staff and all the other issues that comes with, business ownership. So that would kind of be my advice as far as that goes. This June, actually, we'll be celebrating our 8th anniversary in my practice, Purple Plum Dentistry. So that's pretty exciting. All right. So let's talk about a little bit about preparing for dental school. So obviously, things have changed again a lot in the past few years, but some things remain the same. So I'm sure everybody's, all of you guys, like I said, it's a very stressful time. I've been there. I know exactly how you feel. Trying to get your GPA up, trying to make sure you have the right DAT score. And so all of that, obviously, top academics, GPA, DAT scores, all of that, obviously still important. Another thing that's really important is personality. When you go for an interview, it's very important. What they're trying to kind of look at is really to make sure that you have that people skill, you have that personal skill. Because to be honest with you, you really, as a dentist, are dealing with all types of people, all types of patients that come from different backgrounds, different cultures. And you really need to be able to be someone who, first of all, really cares. And second of all, to be able to really relate to people, to have empathy, to really, to connect with people and to be able to care for them. So you're not going to like everybody who walks through your office. That's kind of the reality. So, that's why I think a lot of these interviews are important, that you really show who you are as a person, and let that kind of shine and let your passion show through as well. That's another important thing. I think passion is the most important, thing for me in my career. There's a lot of hard times, I guess, from school to graduation, to work, to ownership. But I think if you're passionate about what you do, a lot of that stuff kind of just fizzles away, and you just kind of keep your eyes on the prize. So make sure that your passion shows through when you go to interview and things like that. And unfortunately, a lot of people are kind of like, going for dentistry or are in dental school, who are just motivated by the wrong things. They're motivated by money. They're motivated by status. All of that's great. But honestly, ultimately, if you don't have passion, don't choose dentistry, because it is too hard of a career for you to just do it for money or status. It's very physically, emotionally draining. You're constantly, like, your neck, your back, you're just physically stressed and hunched over. Patients can be emotionally draining. But basically, if you're passionate about it, you're going to be able to get through the day and not be miserable. Because I have a lot of colleagues in the field that are doing it, and they're doing great. I mean, their financials are great, but they're just miserable, and you really don't want to be like that. So make sure that you're in it for the right reasons. Again, I cannot stress the importance of hands-on experience. Get out there, get experience, go observe, be around dentists to really, really understand. I always say it's just like, some people do shadowing, it's fine. I've had people who shadow, but you're really just not getting the real stuff, the real juicy stuff. So when you're working, you really get to see the good, the bad, and the ugly. So if you get an opportunity to actually part-time work or on the weekends or whatever, some offices are open Saturdays, get out there and do it. All right. So the next thing, this is just basically talking about, the acceptance rates. Dental school has become a lot more difficult to get into. I understand there's a lot more applicants that are applying to dental school. I guess it's becoming more cool to be a dentist. I don't know. And from, I guess, the age of Instagram and all these before and afters has made it more attractive. But when I went to Nova Southeast, I actually started in 2003. I want to say my GPA was around 3.4 and my DAT scores were like 1920. So it was really nothing, that high. But this is something I got from online. I don't know how accurate it is. I highlighted Nova Southeastern. It says that the acceptance rate is 3.7, which is really low compared to how many people are applying to that school. I was kind of shocked by that. And then looks like the mean GPA or the average GPA is 3.6 and the DAT scores are 21. So that's kind of like, I was updating myself, I guess, with kind of the stats on what's going on. So again, talking about passion, working hard for something we don't care about is called stress. Working hard for something we love is called passion. So I know things get hard. You study very hard. You guys are all taking all these, difficult courses and studying and just, again, don't lose sight of what you're passionate about. Some people apply first round or they take the DATs and their score's not high. Don't be disappointed. Just keep going. Take it again. Just keep pushing forward. So a little bit about my dental school experience. I had a very positive dental school experience. Some of my friends did not have a similar experience. They were kind of miserable. They had a lot of kind of tough difficulty towards the end, especially. Don't get me wrong, it's very, challenging, but just like anything else, you guys are already some of the top students. If you're already kind of applying to dental school, have the good grades, but once you get to dental school, you're going to see that now you're competing against everybody who's kind of like you, which is the top student in your class, in your undergrad class. So it gets a little bit more kind of competitive or a little more stressful in that sense. But my experience was that, or my class that I had, I was very lucky to be in a very good class. So my class was less competitive. Everybody came together. We all shared information. Everybody helped each other. So I had a very, very positive experience. Make sure you dedicate appropriate time. Make sure you go in with the right mindset. You don't have any other things in your head. You're clear, you're focused, and you go in there and you just kill it. Be eager to learn and have a growth mindset. Not everybody's good at everything. That's just a fact. Dentistry is half science, half art. So a lot of you might be very good at academics, but might be lacking some, hand skills. Or you could be really good. You could be an artist and you're not as good in academics. So you might, kind of struggle a little bit, and that's okay. Just know that if you have that growth mindset and if you kind of believe in yourself, that you can teach anything to yourself. And there's, again, there are friends, there are people that can help you become better. There's going to be a lot of like waxing. You're going to carve out like the first week of school. I remember they gave us a piece of, wax or soap, and we had to carve a whole central incisor out of it. And, some people did really good and some people not so good, but you just kind of learn, and that's the fun of it. You just have to enjoy the process, So I always say dental school is what you get out of it. Make sure that you're staying on top of everything. I finished my clinical requirements on the third year of dental school. And that way, by fourth year, I wasn't stressing about how many fillings I had to finish or how many crowns or anything or how many root canals, because that gets very stressful towards the end. People are trying to graduate and you have a certain number of things you have to do. And these aren't life patients. So unless you have a patient, you're not going to be able to finish your requirement. A lot of kids who were local If you go to school in your town, it's nicer because you can call your ex-boyfriend or your neighbor or your cousins and say, hey, can I, take x-rays and see if you're good for my, requirements. But if you don't really know anybody in the area, it gets a little tough. So you just have to find patients. You got to be nice to your neighbors and things like that so that they're willing to come and sit there and let you work on them and practice on them. So because I finished my requirements early, I was able to I applied for the honors in endodontics and prosthodontics. So I was both in those two honors programs. And then through that, they allow you to basically spend more time in the specialty clinic, treating a little more complex things that you wouldn't treat in the normal clinic. So I got to do a lot of like molar root canals and things like that that nobody did downstairs in the regular clinic. And then I actually, part of the PROS program, I did my first veneer case in dental school, which was very helpful, which really helped me build my confidence and learn about the whole process of treatment planning and, kind of get the confidence to even do something like that. Of course, when I look at those pictures now, I'm like, oh my God, I can't believe it. It's probably the worst thing, but that's nice when you're in that school environment and you have your professors and, you have the support. That's when you want to do these things. You got to build the confidence. That's super important. And some people who kind of don't get enough from dental school experience, there are some residency programs out there, GPR, AGD, which you can apply to. It's usually a 1 year or 2 year program in different cities and hospitals. And that's a very good way of kind of gaining more experience. It's like 1 year of just clinical work without any schoolwork. And that's kind of helpful to a lot of people to build confidence before they go out, in the real world. All right, so we're going to talk a little bit about associateship versus ownership. So that top picture that you see, that's my very first job that I got in South Florida. So as you can see, it was a little bit of an older office, and you can see all of those charts in the background. You don't really see that anymore that often because everybody's digital these days. I had the pleasure of working with an older gentleman, older dentist, and he was my mentor. So it was kind of nice having him there just to kind of, give me the confidence that if I just didn't know something, that he would just be there for me. So I really liked that setting and that mentorship aspect of it. Again, I learned so much in the office. And the bottom picture is me and my staff celebrating our 6th anniversary of my practice. So a couple of things about, associateship versus ownership, like what's different, advantages or whatever. So as an associate, basically it's very important to have good chairside manners. You have to be customer service oriented. So if any of you guys have had jobs that involve customer service, that definitely comes in handy when you become a dentist. And then you're basically quarterback of the treatment plan for the patient, meaning that if you're a general dentist, everything stems from you and your plans. You decide the patient needs to go get braces first, if they need to get an implant, so you need to the timeline, you need to plan the whole thing. So the general dentist is actually the most important player in the whole thing, just kind of getting things organized and then sending patients to working side by side with other specialists to make the best outcome for the patient. It's important to be efficient as a associate. What I mean by that is that, especially by the rise of these DSO offices, the chain practices and things like that, where they hire associates and they expect you to produce. Basically, I was lucky not to work for a DSO ever, but I know that's a reality. And there's a lot of pressure for new dentists to just produce a certain amount of money, and that puts a lot of pressure on them. So it's important to learn how to be efficient without compromising the care you give to your patients, and without compromising the quality of the work you do. So it's important for you to learn not to also kind of be ethical and not do anything that's goes beyond what you're comfortable with doing, and kind of standing up to what you believe in. So, and don't let anybody else tell you you need to do this or you need to do that, just because they're the owner of the practice, basically. You do a lot of patient education. You learn how to communicate to patients, communicate to your team. So you have to be a good team player, because in our profession, you're going to be always working with, your team, and it's important that they're kind of like on your side, whether you're an associate or an owner. They have to believe in you. They have to believe in your skills. They have to believe in who you are, and they have to believe that you're giving good care to your patients. And that's how, from that phone call, from that initial interaction with patient, this is all going to kind of show through in your staff's body language and everything. If you're working good with them. So even as an associate, some people have a lot of clashes with the office manager or with the assistants. It's difficult, lots of personalities, different things going on, but you just have to kind of, again, be humble, learn, listen. Some people don't like to work with new dentists. Or whatever, some people are threatened or whatever it is. So it's important to learn how to be a good team player. Also working with other specialties, you need to know how to handle that, how to handle the relationship of how do you, refer a patient to someone, be very clear about what you expect. Oftentimes I hear, general dentists sending a patient to the specialist for something, and the patient comes back getting an implant in the other side of their mouth, and they never asked for it. And now there's a situation where they cannot restore it, or there's a problem. So it's very important for you to have a good network of specialists that you work with, that you have mutual respect, and you know each other's work, and that you know that they would never do anything to harm your patient or do something to compromise your care. Continuing education. I cannot stress this enough. You never stop learning, okay? Just because you're done, you graduate dental school, you have a big DDS, DMD degree behind you, that does not make you the know-it-all. That doesn't make you, basically the guru in dentistry. That's just the beginning, which is why we call it practicing dentistry, right? Because we're always practicing, we're never perfect. So continuing education is super important. I take numerous hours of continuing education. I travel, not for COVID, the whole past year. We haven't done much traveling with that, but typically I take at least, one hands-on course, or a long few, like 5-day, 3-day course. I'm part of Spear Education, which is a big education forum like CE Education in Arizona. I take a lot of their courses. I've done a lot of other courses kind of all around. And I try to learn every year. I try to better myself every year. So you never stop learning. So remember that. So on the right side, you see the ownership. So what's different about associateship and ownership is that ownership includes everything we talked about in the associateship column, plus more. So now you're running literally a small corporation, even though it's just a dental office. But literally, you're still doing marketing, you're still doing staffing, hiring, human resources. You're dealing with so many issues, problematic patients, you name it. There's so many things, but you're just one person, and you're really running this little small corporation while working, while being productive, and while you're chairside with your patient, which makes it a little more difficult if you're just a small solo practitioner like me. It just makes it a little more difficult. Knowing every aspect of the business, not just the clinical part. So, like I said, I was clueless to business, so I would highly recommend taking some business courses if you can. Staffing is one of the biggest challenges actually these days for all my colleagues and my friends. It's been very tough finding reliable, good staff, and once you find them, you train them, and a lot of people leave, whether they move. So it's like a revolving door. There's a lot of staff turnarounds, so it makes it very hard because you put a lot of time and effort into your staff, and then kind of have to start from scratch. Community involvement is very important once you're owner. So you want to be well known in your area, in your community. You want to also help out. You want to volunteer your time if you can. And then lastly, it's very important for you to invest in your team because they are your largest asset. They are going to be the ones who make you or break you. So it's very important to invest in their time, to educate them, to connect with them, to be there for them. So that's super important. So running a business, these are just some pictures I put in there. That's top left pictures that you see. That's my assistant, Claudio. I'm in the chair, in the dental chair. I'm actually, I guess, was taking x-rays of my teeth, and I was trying to get a cleaning that day. But meanwhile, I have the checkbook on my lap, and I have the phone on my thing because you never stop running the business. So whenever you don't see a patient, you're really taking care of other things. This is my team again down here. I couldn't do what I do without them, without their support, and without them really just being there for me. I really appreciate my team, and they're kind of like my work family, basically. Dentistry is definitely not a 9-to-5 job. So, or I should say, and being a business owner of a dentist is not a 9-to-5 job. If you're an associate, you work very hard, you're running all day, but you get to go home and you can collapse on the couch and you can relax and you don't have to worry about it. But as a business owner, you're worrying about stuff. Bills, there's licensure, there's all kinds of different things that I never knew existed until I became a business owner. That's kind of all the mail that I had built up from a couple of weeks or 1 week of not being there that I have to go through. So there's a lot to do when you're not being patient. The challenges of being a working mom. So I know now dental schools are actually more than 50%. A lot of the stats show that more than 50% of a dental class is girls. So go ladies. I am so happy to see that. I think the trend is definitely changing. No offense to the guys out there, but I think that women definitely have a very gentle, good demeanor and gentle hands, and a lot of the patients do appreciate that. So I really think it's a very good profession as a woman to have. It is, but it has its own challenges. So obviously, as a working mom, sometimes I experience a lot of emotions, some guilt, some since I started my practice and they were very, very young, and you have to learn how to balance things, and it's not easy. So these are some pictures. These are my daughters, Ava and Isla. I had to recently move practices, and this was when we were just looking at the space for the new practice. She's wearing my jacket and holding my purse and pretending to be me. This is when we got the office building and we were about to build it. They were there with me all the step of the way. They actually helped out with some of the stuff. This is them all tired after school with their backpacks, sitting there watching TV while I'm finishing up and, writing my notes and there's a million things to do at the end of the day. So they actually get to hang out with me a lot, sometimes at the office. This is my daughter, Ava, in the front with my patient care coordinator, Carla. They're just kind of hanging out. All right, so I actually had to build a whole new dental office. So as I said, I bought an existing office. I didn't really get to design anything. I didn't get to really, I did a little bit of an upgrade. The space I got, it was in a very professional building on the 14th floor, had amazing views, which is kind of what drew me to it. And everything was pretty much set up. I only kind of had this whole purple plum concept. So I turned everything very feminine and purple, and just kind of did some changes. But basically the structure was the same, the chairs, everything was there. I just added some equipment. I bought new ADEC chairs and things like that. So over the past 7 years, I kind of invested a lot of time making that practice what it was, until right before COVID, actually. It was November of 2019, where I received a letter saying that that building that my office was in has been sold, And since I was just leasing, I didn't own the condo, that I had to get out of the space by August. So that was a big shock for me because I had really spent a lot of time working on that, kind of building that practice. And you guys know that it's very important once you're in a certain location that your patients kind of know you, they come to you, you work hard to build a patient, you build a client. So that was kind of like a very stressful situation for me. And I had to find something really quick. I had to figure out what to do. And I still had lease left, but basically there was, that was it. They're just, I guess they decided to make residential condos and they can do that. So I had to really fast find a space. I had to build a dental office from scratch, like design everything, architecture, all of that. I had to move the equipment, make some of the stuff work in a new space. And I could not do, basically, I only could close the office for 1 to 2 weeks in between because you cannot stop care. You cannot not be open for your patients. So it was a very stressful time. Once the process started, then COVID happened. And of course, you all know how that affected dentistry. We had to shut down the practice for about 2.5 months. So that was pretty significant, when you don't have income coming and you have all of this going on, it was a pretty stressful time. However, I used that time in a positive way. I used the time when I was home to kind of basically work on the build out, to work on this, planning, architecture, how I wanted a new office. And I kind of try to have fun in the process because it was fun designing an office, this time the way I wanted to, with my style, with my taste, kind of putting things that also functionally make sense to me, and it just makes it make it much easier. So my office was, once we planned everything, they started building it, and in literally, I want to say 60 business days, they prepared this new dental office. So it was crazy how we kind of pulled that off. And in August, we started basically working in the new office. So now we're finally kind of settled into the new space, and we love our new space. So this is kind of like a little celebration with my family, my mom and dad, my husband, my staff. We had a little celebration in the new office. So it was kind of fun, the process of designing everything and kind of seeing it come together. All right, everybody still there? So next section is a day in the life of a general restorative dentist. Okay, so procedures I perform. Just common procedures that, basically fillings, crown, bridge, implant restorations, onlays, inlays, dentures, partials. I have a lot of experience actually with removable stuff, with dentures. I used to be called the denture queen back in Florida because I used to treat a lot of the elderly. So I kind of became good at it. And porcelain veneers, I love aesthetic dentistry. That is definitely my passion. I love just, how the aesthetics also kind of mix in with function. So not only you're fixing someone's aesthetic appearance, but you're also bettering their function of how they're chewing, how their teeth are kind of like wearing each other down, and you get to fix that. So it's really nice to be able to do that. I provide Invisalign also for my patient, just very simple cases. Anything that's a little more complex gets referred out to my orthodontics. We do in-office whitening, we do geriatric dentistry, pediatric dentistry, even though pediatric dentistry is not definitely my favorite thing. So anything that gets a little too complex, any kid that kind of starts acting up, gets referred to the pediatric dentist. And then very limited oral surgery. As I said, the nice thing about being a general dentist is that over time you actually get to choose what you love, what you enjoy, and what you really don't enjoy. It's kind of like, do what brings joy to your life, right? So root canal did not bring any joy to my life. So I just cut it out. I was like, I just refuse to do root canals, and that's it. And it was easy. And I actually have a doctor who comes to my office and like once a week or twice a week and does any root canals that our patients need. So, and then if anybody needs emergency care or anything beyond that, I work with specialists outside of the office. So it's really nice that I don't have to do something that kind of just stresses me out. And that's the advantage of being a general dentist. I also don't do any kind of advanced surgery, periodontal surgery, implant placement. We also have a periodontist that comes to our office and does that stuff. I used to have Dr. Eugenia Prokopitz. She's really good. She's a periodontist that used to come to my office, 3 years in a row. Now we have actually Dr. Fadi Hassan. I think you guys actually had him as a guest not too long ago. I saw his picture in one of your Pre-Dental Universe posts that you had. So he's awesome. He comes to our office and provides periodontal surgery for our patients. So I'm lucky to have these amazing individuals and to be able to work with them to give the best care for our patients. So non-chair side activities. Every morning we have a morning huddle. Super important because I want everybody to get on the same page. My staff and I, we arrive there early, usually about 20 minutes to half an hour earlier, to get prepared, to get everything ready, and to also kind of get on the same page. We want to know who's coming today, who needs what, and then all the details about treatment, so everybody knows exactly what's going on. If you're not seeing a patient, part of your day is going to be spent treatment planning. A huge part of my day is actually with treatment planning. Sometimes after my staff leaves, I stay in the office when it's nice and quiet, and I actually treatment plan cases. I take a lot of photos of the patients. I do some drawings on their photos. Some of these I share with the specialist. I put arrows. I communicate really good, so the specialist doesn't have to do guesswork. So they know exactly what my expectations are, and that's very helpful. It's very important as a business owner to have systems in place. If you have systems in place, that way everybody can kind of follow that protocol. So your staff is not lost. They kind of know what to do, where to go, and how we do things. So that if one day I'm not there, literally they know exactly what to do without me. So that's kind of important to have in your business down the road. We're constantly growing and evolving. It's important to grow with the times. Dentistry changes and evolves in a better way. A lot of my elderly patients tell me kind of horror stories, how they have their teeth pulled without anesthetics, how they just were screaming and yelling and kicking and the dentist didn't care. And they tell me that dentistry has definitely come a long way, and they're happy to see that we're not medieval anymore. So that's definitely good. But even as, I'm still kind of a younger dentist. Yes, I've been practicing for 14 years or so, but things are changing even from when I graduated. So I try to kind of stay up to date with all the technology and all the advances that are kind of going on with dentistry to try to bring the best to my patients. Team communication and education, we kind of talked about that. I'm constantly communicating with my team. Sometimes I over-communicate, but it's important so that everybody knows what's going on. And I like to invest in my team's education. So we take a lot of time when we have a downtime or a day that's not as busy. We schedule some team meetings. We watch videos together. We watch, online resources for anything that they should kind of learn more about. And we're big on patient education. All of our patients, I spend about an hour and a half with every new patient that comes through the door. That's a lot of time. And we actually communicate that with patients. And we say, not every patient is a patient that should be seen in our practice, because this is my philosophy. And this is how I run my practice. And if someone doesn't like that, then they have other options. There's a million other things out there. So we communicate that very clearly, because the way I do things is very comprehensive. I believe that patients have to be treated as a whole. One thing I remember from dental school, I believe it was like the first week of dental school. One of our, professors said, "You never see a tooth walking into your office." And I always remember that. It's so true. You're not treating a tooth. You're not just worried about, let me do this filling or let me do this, you're treating a whole person. So your approach should be very holistic in the sense of like, this tooth is in a person's mouth who's attached to this person's overall health. So you really want to get a good history of how they sleep, how are they breathing, do they have other issues, are they grinding? Everything is so related, and there's so much knowledge now, and it's getting out there now too about sleep apnea and how dentists can actually identify signs of these things. So it's amazing how a lot of dentists are still just, oh, let me just kind of fix your tooth, versus really, let me just kind of treat you as a whole. Let me make sure that not only I'm treating your teeth and your mouth and your oral health, but if I know some information that could be useful to saving your life because you might have sleep apnea, then I will give you that information, and I would encourage you to go seek help from your physician, because you're really an oral physician. You are the doctor of the mouth. So you have to kind of take yourself serious like that. Don't be like, oh, little teeth, I'm just a tooth doctor. No, you are a physician. So you have to kind of bring that respect and that level of information and care to your patients, basically. So we do a lot of education. I show, I kind of give the patients tour of their mouth and their whole overall. And most of the time they're blown by the information, because they're like, nobody has ever taken this much time, or nobody has ever told us this information, which is kind of nice because they get to maybe learn something from that, and that makes me happy. I definitely don't get compensated for it. Insurance really doesn't pay much for your time, but that's okay, because to me, I feel like this is the most important visit where you cultivate the relationship. And I always say this is kind of like a first date. You're really kind of dating your patient, trying to see if you're the good match for them and if they're a good match for you. I always tell them, I'm like, listen, I'm not for everybody. So just because you're here, it doesn't mean that we're obligated to see each other. You have other choices. And if they really don't buy into how I do things, then, or if it turns them off, then it's better if they just kind of go somewhere else. If they just want a quick, speedy, like they call and say, I just need a cleaning. If you need a cleaning, then maybe you should go to a car wash or something and put your mouth through there, and they just clean your teeth without knowing who you are, without having x-rays. I just had x-rays and I don't want you to take x-rays. How can I treat you without vital information that I need about your health? If you want that, I'm not the person for you, right? Someone else is willing to do that. Just a quick cleaning. I'm not willing to do that. I need to get to know you. I need to get to your mouth, know your mouth, your history, everything, to be able to give the best care. So you will get to develop your own philosophy over time. And then, of course, self-education. I'm part of study clubs at the moment. I've been kind of lazy with that stuff because of COVID and the fact that I have the kids at home. So my attention has been kind of everywhere. But typically, I'm very active with, after work, sometimes in-person CE courses and small CE courses, or I take time and travel to different states just to kind of some of these continuing education courses. So basically, these are just some of the technologies. I'm not going to take too long on this. I try to, again, have some of the good technologies in our office. 3D imaging, which basically shows us what the 2D doesn't show. We have the CBCT. This is the cone beam, which basically it does a pano, which is the 2D on one side and the 3D on the other side. So you get to really see things that you couldn't see before. So that's a very cool technology. We have the NOMAD, that's the handheld x-ray unit. I have the SDA, which is single tooth anesthesia, to make things less painful for patients. I'm all about that. Painless dentistry. And then we are actually just getting the iTero element, which is I'm very excited about, which is the digital scanner. So instead of this gooey impression material that you see down here in the nice purple and orange, that's going to be replaced by our scanner. So I'm very, very excited about that. We've ordered and we're waiting for it to arrive. So that will be the new thing in our practice that we're going to be offering. These are my team members. Like I said, they are my family, my work family. This is Michelle, my office manager. She's been with me for 5 years. She has like 25 years of experience in the dental field. This is Claudio, my assistant. He's actually a dentist from overseas, the dentist from Europe. And he really wanted to, while he's applying to dental school and doing his applications and kind of going through the process, similar to what you guys are going through, he really wanted to gain some experience working in the United States. He's half Italian, half Romanian, so he really kind of wanted to know what work is like in the United States. And he actually just got into BU. So yesterday he found out he got his letter. It was a very exciting time for him. So yay for Claudio. I'm super excited. I've been part of his journey, and he tells me every day that working with us at my office has been a great experience for him. He gets to really experience a lot of stuff, and he feels very confident and ready to kind of start school. And hopefully his program is only 2 years versus you guys 4 years. So hopefully he'll be finished in 2 years and he's going to come back and be my associate. I can't wait for that. This is Carla. She's my patient coordinator. She's actually working on her master's degree right now, part-time, and working for us. She's very lovely, very good with our patients. She knows everybody's who had a baby, she knows everything. So she kind of fills me in with all the other stuff that I need to know about patients. That's awesome. This is Mariella. She's my other dental assistant. She's actually been with me from the beginning. So she's the oldest member of my work family, and she's wonderful. All right. So we also have fun. Dentistry is very high stress, as you know. So, we work hard to run a smooth operation, but we definitely have happy hours. With lots of drinking, we have parties, and we have lots of fun with our patients as well. It's important to have fun. Like I said, we basically see I see my staff more than I see my family. So we try to make it fun as well. We also actually go to a retirement facility. I provide care for the elderly are kind of immobile. They cannot get out of the facility. So we go to them, actually. We pack up our bags. We go, they have a little operatory at the facility. So I'm their official dentist there. So Claudia and I pack our bags 2 Mondays a month, and we go treat our elderly there. These are some pictures from the retirement facility. We also have educational sessions. We teach them about how to take care of their mouth better. And that's kind of one of the population that most needs it. So it's very important to do that and to get involved. All right. So lastly, we're going to cover some cases with you guys. I guess this is kind of like your shadowing portion of the whole thing. So I have 3 cases that I chose that are kind of interesting maybe to you guys. I definitely like these cases, so I wanted to share with you. So the first case is going to be a full mouth reconstruction case, or called FMR. Or some people call it full mouth rehabilitation, is when you really kind of overdo the whole mouth over, basically. The second case is about hybrid implant supported prosthesis. Some people call it all on 4, all on 6, or all on X. That means the number of implants that the prosthesis is sitting on. And the third case is about more aesthetic case. So that's a porcelain veneer case. All right, so this is our first case. This patient came to me referred by someone else. He actually came to me as a second opinion. His concern was worn down teeth, and that basically his teeth look, a lot, makes him kind of age and look a lot older than his age. And that he's very concerned about the chipping and cracking and all of that stuff in the wear. And he had already had Invisalign at a different office to set up the teeth in a better position so that he can restore his teeth. And that's why a lot of the cases are multidisciplinary. You work with the orthodontist, you work with the periodontist, so it's not one person doing it all. So these are his pre-treatment photos. As you can see, he's got a lot of wear on his teeth. You can kind of see like the pattern of, the teeth are kind of like flat, as if you took like a saw and you just cut them flat. Lots of wear on the teeth surfaces here. Not a whole lot of restorations on his teeth. You can kind of see that old amalgam there, but overall just wear on the outside areas, some recession, but those are his concerns. So part of the process initially, we kind of want to like set up an idea of where we want, like where are his teeth now and where should they really be in his mouth, right? The size and the shape and kind of the gum levels and things like that. So So there are some tools out there, there's different ones, but there's this tool kind of like that gives you a smile preview where you get to kind of put like a preset set of teeth in there just to kind of give an idea to yourself and to the patient of what you have in mind for them. What are we looking at? What are we kind of trying to achieve in this treatment of, fixing his bite and his teeth? So there's a lot of work that goes on in the background. There's a lot of, study models, a lot of measurements, figuring out where his bite should be and where his bite is now. So the picture on the left is basically measuring kind of the distance from canine to canine to see how much has he really worn down his teeth, because you can definitely appreciate that he's worn down a lot of tooth structure. So in this case, it's very apparent to me that we're going to have to open his bite up because all this slowly, all this wear has caused his teeth to get shorter and his bite has collapsed. So we're going to have to actually open the bite up and put him in a better position. So we do something called the Diagnostic Wax Up, which you see over here. That's me just kind of going right and left, trying to figure out, how his function is going to be. Then we bring the patient in and we prep the teeth. These are preparations, basically, based on the guides that you have, you prepare the teeth. Then you temporize your patient, uppers and lowers. Then you let the patient to kind of be in that temporary phase for a while because you want to try it out and you want to make sure that the patient's going to be comfortable in this new position. Then I collaborated with Dr. Fadi Hassan, he's the periodontist who worked with me in this cool case. And basically you can kind of see, those are my temporaries. He lifted the gum up. That's him with the temporaries. He does the gum lift. And you can kind of see he goes around and he removes some of the bone and the gum. And then he sutured the patient back up. So he did an amazing job with this. And then once everything heals and everything is settled, now we're ready to get the, take the impressions, send all of this to the laboratory and to have laboratory kind of return final crowns and porcelain. These are all the lowers and these are the uppers. And that's the finished case. So it's kind of incredible to be able to get a patient from here to there. And definitely, I know like there's a lot of stuff on Instagram, before and afters and stuff, but what's definitely for sure is that nobody really knows the process and how much work and thought and how many hours has really gone into this. I definitely spend a lot of time planning and definitely a lot of time just in the process too. It took months, honestly, from start to finish to get there. But once we're there, the patient obviously is ecstatic. His function, his appearance, the way he chews, everything has improved for this patient. He's the most wonderful person. I could not choose a better person to do this on. So I'm super excited about this case that we finished recently. This is kind of like his full smile. You can kind of see how it's just much nicer, much healthier. And that's that. So the second case we're going to go, are we okay with time, by the way?
Yes.
We're good with time? Okay. The second case that I'm going to go through is a hybrid implant supported prosthesis. So this patient, again, he's been my patient for a few years. He's been kind of, he doesn't like to come to the dentist. So every time he comes, it's either something's broken or he's in pain. So he ends up losing some teeth. As you can see, he had a couple of broken teeth. He had other teeth that were broken, and he was wearing a partial denture, which he was not happy with. So we did a lot of planning again. I don't have the pictures there, but we decided that we're going to do a hybrid prosthesis, which is basically removal of all the teeth on the arch, whatever's remaining. He has 1, 2, 3, and 2 root tips, right? Removing all of that and basically placing implants in strategic places. And then having a prosthesis, which is kind of like a mini denture almost initially. It's called a hybrid to fit over those. But the advantage of this is that it's actually attached to the implants. So the patient doesn't have to remove it. It's not like a regular denture that you just have to remove or it can fall out of your mouth. It's actually screwed into your mouth. You come in for cleanings ever so often, every few months. The screws can get removed. You can clean it. Patient can clean underneath it. It's just much nicer because they feel like this is part of them rather than a full denture. This is surgery day. Again, there's Dr. Hassan, there's Claudio, and myself. In fact, for this patient, he requested not general anesthesia. He requested, he wanted to be out. We only offer nitrous at our office, so we had to actually bring in an anesthesiologist to basically get him comfortable. So it was a full setup that day. We did not have any other patients at the practice that day. It was all about this patient. Started super early. The anesthesiologist came and kind of put his stuff there and started him on IV and all that good stuff and all the good medications. Once he was happy and good and in a good place, relaxed, Dr. Fadi kind of started his work. That's all of his implant setup that you see over there. And even though I wasn't doing the surgery because he's my patient and I wanted to be kind of involved and part of the whole thing, so there I am, you see me in there as well. So here's the picture with all the implants. He placed 6 implants actually for this patient. You can kind of see the gum and everything, the bone and the gum and all the stuff reflected. I appreciate surgery, but I don't like to do it. So it's nice when someone else does it. This is his x-rays, the panoramic x-ray. You see all the implants there. And basically we also had the lab technician there ready to go with all his stuff so that he had to convert a denture into this hybrid prosthesis. So there was a lot of players in the game. So this is his supposed to be a video. Let's see if it's gonna play. So that's kind of what it looks like right away. And that's him super happy. So he kind of went from this situation to having a nice smile. He thinks that smile is too perfect for him. So once we give him the final pair, which we're working on, he wants his teeth to be set a little bit imperfect to make it seem more natural. So that's the plan for him, to make him happy, basically. We're actually working in the phase 2 right now for him. So this is the stuff that the lab has kind of returned to me. We're supposed to see him actually tomorrow to get his final impressions and to make the final prosthesis, which is going to be a lot nicer than initial thing that we've given. So that's it for case 2, and then I'll quickly go through case 3, and then we'll kind of jump into questions, okay? So this is kind of like a fun case. This patient came to me. She's super nice, nice personality. She just wasn't happy with the wear in her teeth. She didn't like all these jaggedy edges, the crowding in the bottom. We talked about different options. We always talk about orthodontics as the first option in a situation like this to kind of get things in place. She really wasn't interested in orthodontics. She really wanted something more aesthetic. That's going to be quick, takes few visits and she's done. She doesn't want to be kind of married to any kind of long-term treatment plan. So again, the first step is lots of planning goes into it, pictures, lots of drawing, kind of trying to figure out what needs to go where. And then we do the diagnostic wax up again, like the other case. I didn't put those pictures in here. I didn't want to make it super long, but basically, these are the veneers, uppers and lowers that came back from the laboratory. The lab technicians are real artists. They put a lot of details into these restorations. There's a lot of character they put in here, so the teeth don't look like those chiclet, fake looking, I always say the best aesthetic dentistry or cosmetic dentistry is the one that people cannot pick out. They cannot say, oh, look, you had your teeth done. It's the one that they say, oh, you look nicer. Like, what did you do? Like, it looks nicer. It enhances someone's smile without really being obvious. You always kind of want to stay within the same shape, and you don't want to go super, super white. What we used to call Boca white in Florida, whereas that really super chiclet look that really I don't really recommend that to my patients. So here are the veneers. That's what they kind of look like. She also had couple of crowns in there. So this is just to show you how thin a veneer is. It's like 0.6, 0.5 millimeters is the thickness of that veneer. And this is her before and afters. So this was the before, this is the after. You can kind of see how straight now her lower is. It's like instant orthodontics. Look how far these teeth used to go. They're a lot higher here, right? And here it just kind of follows nicely. So now if she's functioning, you can just kind of like slide right and left and all around without really colliding your teeth. So she was super happy with the result. This is kind of like the, again, before and after of her smile. That's another close-up of her smile. And that's it. So this is my favorite saying, guys. I always say measure 10 times and cut once. That's very, very important. You don't want to cut and then later be like, oops, the daisy, I shouldn't have done that. Anyway, so thank you so much for having me. I really enjoyed preparing this lecture for you, even though I used a good part of my off day today to do this. It was a pleasure. As I said, you can check out my practice, purpleplumdentistry.com. Feel free to send me any emails, any questions you have, any advice, anything at all. I'll try to respond to you. And then you can follow my practice at Purple Plum Dentistry. And then this is my personal account, Dr. Anita Kiani. And that's basically it. So I guess Sherry and Tiffany are going to open it for question and answer.
Yeah, thank you so much, Dr. Kiani, for taking the time to be with us today and preparing this presentation. It was really interesting to learn about your experience with your business and your associateship and your cases as well.
Thank you, Tiffany.
With that said, we have a few questions in the chat for you, if that's all right.
Sure.
Okay, so the first question is, if you attended dental school in another state and wanted to go back to your home state to practice, would you have to retake the exam specifically for your home state where you want to practice?
Yes. So definitely there's different, again, things are changing constantly. So when I graduated dental school in 2007, there were multiple boards that you have to take. Florida has its own boards. Florida does not accept anybody else. They try to limit the amount of practitioners who get tired of up north, who are cold, and who want to move to Florida and retire and still work. So that's why I think they kind of have a very tough board as well, to try to limit the number of dentists coming in. So, and then there's Northeast, there used to be Northeast Regional, there was CERTA, which was the South, like Virginia, like us, and a couple of other states. So there was like different ones that you could take. Western Regional, and some of the states accept the other exams. So I don't know how that has changed, and I know it has changed. So I don't know the recent information on this, but when I graduated, I definitely knew that I'm gonna end up in Virginia at some point. So I definitely wanted to take the boards for here, but I wanted to also practice in Florida. So I did take the Florida boards and Western Regional board because that board was being offered at my school. So your school that you go, they might actually bring other examiners to your school to offer different exams. And that's kind of nice because you're familiar with your own school. You don't have to go to a whole new place which you're not familiar with. So if it's being offered at your school, you're really lucky. You have your patients there, you can just take it there. And for me, I had the Florida boards and the Western Regional boards scheduled like back to back. Like 1 week it was Florida boards, and then the following week I had the other board. So, but they're very different. Every board wants something different, so you have to set it straight. Like these guys don't like it if you do it like that, but they like it like that. So you need to kind of set it straight. But yes, you do have to take different boards.
Thank you so much for your response, Dr. Kianimanesh.
Sure.
Another question is why you chose Nova over other colleges. What did you see in Nova that made you choose it?
So who doesn't like palm trees? I'm kind of palm tree crazy. So, so actually, I had applied to a lot of like East. I never applied to West Coast because I knew I just didn't want to go that far. I applied pretty much to everything: New York, Boston, everything. So I actually the first place was University of Buffalo that year when I applied, and and then it was BU, Tufts, Temple. So I got like waitlisted. I got accepted in a couple of other places. So actually, Nova Southeastern was the last school that called me, and I had already put a deposit, up north. So I said, oh, why not? I'm just going to go kind of explore. It's Florida. Who doesn't like Florida? So I'm just going to go to the interview. And once I went to the interview, I literally fell in love with the campus. I just loved how, of course, it's a beautiful campus. It's really nice. And everybody was so relaxed, everybody, just all the professors, everybody who interviewed me, everybody's just like so happy. They're playing golf. They're not stressing. Up north, everybody's miserable. I just feel like, I don't know. It was just a vibe. I loved it. So I called my mom at lunch break and I said, I think there's a little change of plan. If they accept me, I definitely will come to Florida. So that's kind of why I chose it.
Thank you, Dr. Kiani. So the next question is, what advice would you give to a future dentist that you wish someone else had given you, like during dental school and while practicing?
What advice? So a lot of things that I talked about, to you guys, I feel like business. I really was clueless to the business aspect. I knew I loved dentistry. I knew I had a passion for it. I knew I loved treating people, but nobody prepared me for the business aspect. So it's very important if you guys can kind of open your eyes and learn about that. Even when I was an associate, I really didn't, bother really learning. I was just kind of working more on fine-tuning my skills, my clinical skills. I never, asked questions or try to find out how insurance companies work. I never really got to know that stuff. So it was a rude awakening where I got my own business and I was clueless. I literally was clueless. So I would say if you have the opportunity to learn about the business aspect, definitely do so.
So to kind of follow up on that question, how did you end up learning all of the business aspects of owning a practice, from like staffing to getting supplies?
I was just thrown into it, literally. It was just like, boom, here you go. I had one of my first employee, in fact, is a family friend. Her name is Emily. I called her up. She's pre-dental, actually. I called her up. I said, Emily, she was working at a dental office. I was like, I am buying a practice like next week and I don't have anybody. I don't have staff. How much do you really know about running an office? So she said, I know a little bit of front desk. I know assisting. I was like, great, you're hired. Here we go. So that was it. Just me and Emily, we started the office. I did not know how to charge patients. They had insurance. I had no idea. So they would just walk in there, they would get their treatment, and we're like, bye, have a nice day. I literally did not know how much to charge them. It was that bad. So I had to teach myself from the ABCs, from the basics. I had to learn everything myself the hard way. But it's, if you're motivated and you have to do something, you just under pressure, you learn. But like I said, if there's any kind of program that can teach you that stuff, I really don't know. Some schools, I guess they have a MBA / DMD. I think Temple has something like that, or Penn or something. But anyways, if there's any opportunity for you to learn that, I think that would be a great advantage. Some people have parents that are business owners, or all of that experience really comes in handy. I just didn't have any of that. So, but I learned it and I survived. So there's hope.
Thank you so much for your response, Dr. Kiani. One last question is there anything else that you wish you had done differently during dental school and while practicing?
Done differently. I think in dental school, I really think I got a good full experience. Like I said, it's a lot of challenging times, but I made some really good friendships, and I had a very good relationship with my professors, and I still actually stay in touch with some of my professors, which is, it's been years. And in fact, currently I have an associate who just graduated from the Southeastern 2 years ago. His name is Dr. Kaz. And the way I met him is actually through my professor that I stay in touch with. He recommended to him. He said, you know, somebody who just graduated is moving back to Virginia, looking for a work opportunity, and that's how he ended up with me. So, like I said, I think, you know, make sure that you make good relationships, good connections with whoever you meet, whether they're your classmates, your professors, because you never know down the road how they're gonna, you know, they're gonna help you or you're gonna help them. So I think for me, like I got a very good, I don't have any, I guess, regrets or so in dental school. The only thing I would say, maybe when I was an associate, I wish I would have paid more attention to the business part of things and not be as clueless about running a business. So maybe that would be something that, you know, I would do over. So if you have a chance to really be an associate, try to learn, like try to absorb, try to ask questions, try to sit around. If you don't have a patient, don't go on your phone and like be on Instagram. Go sit there next to the office manager, go sit there in the front and see what they're doing. Ask questions, find out, you know, how come they didn't pay for this? How come, you know, insurance is a huge problem because you're constantly fighting. If you're an insurance provider, you know, it's very hard if you want to do good quality care and to deal with insurance. So you don't let insurance determine kind of our care. So all of this stuff is something that you learn. So make sure that you really are getting the full experience when, if whether you're shadowing now or dental assisting now, or if, you know, when you're an associate. So that would be kind of my advice.
Thank you, Dr. Kiani. So unfortunately, that is all the time that we have today for questions. Thank you so much for all the advice and for taking the time to be here with us. For everyone who joined our session today, the link for the quiz will be posted on our group me. And yeah, thank you again, Dr. Kiani.
Thank you, guys. I wish every one of you lots of luck, and I hope that if this is truly your passion, that you really, all of you, get into your top choice universities. If any questions, any help, any advice, again, my email is there for you guys. If anybody local also is interesting, I told Sherry as well and Tiffany that if anybody in Northern Virginia, Washington, D.C., Maryland area, DMV area is interesting to a part-time job opportunity or any kind of observing, anything at all, any help at all, I'm definitely open. So count me in.
Thank you so much, Dr. Kiani, for your kind wishes, and be sure to follow Dr. Kiani on her Instagram platforms and reach out to her with any questions you may have. Thank you again for your time and for your wonderful presentation.
Thank you. Have a good night, everybody. Bye.
Bye.